This is a 24/7nursetutors.com lecture. 24/7 Nurse Tutors, providing unlimited tutoring.
Welcome, and thank you for joining us. Part 3.
What is the most commonly abused substance in the world? You guessed it, alcohol. So let's spend some time and discuss this. Alcohol is a central nervous system depressant. Physical dependence, a biological need for alcohol to avoid physical withdrawal symptoms. There's also a psychological dependence, a craving for the subjective effect of alcohol. Intoxication with blood alcohol levels of 0.1%, 100 milligrams of alcohol per deciliter of blood or greater. Disulfiram, antabuse, is the therapy. It is an alcohol deterrent. Clients on this therapy should avoid anything containing alcohol. Alcohol withdrawal can occur 24 to 48 hours after the last drink. The drug of choice, chlordiazepoxide, Librium, is the most commonly prescribed medication for acute alcohol withdrawal. Delirium tremens, alcohol withdrawal delirium. This is a medical emergency. Death can occur from myocardial infarction, fat emboli, peripheral vascular collapse, electrolyte imbalance, aspiration pneumonia, or suicide. How many hours after the last drink could a client go into DTs? 48 to 72 hours. Now let's discuss autism. The islands of genius, usually seen when the child is between 2 and 3 years of age. The child may have trouble learning the meaning of words or do the same thing over and over, like saying the same word. They have trouble adjusting to changes. Asperger's disorder has similar features of autism. Children with AS become obsessively interested in a single object or topic. Dementia and Alzheimer's disease. Progressive disorder redirect. There's a long-term and short-term memory loss. The most common type of dementia is Alzheimer's disease, which is an irreversible form of senile dementia caused by nerve cell deterioration. Providing a safe environment is a priority in the care of this client. Perceptual distortions. Illusions that are based in reality. Hallucinations, the five senses, with no basis in reality. What should you ask for auditory hallucinations? Right, ask what they are saying. Neuroleptic malignant syndrome. This can be fatal and occur at any time during therapy with neuroleptic antipsychotic medications. The symptoms are a high fever, 102 to 104 degrees, hyperthermia, irregular pulse, tachycardia, tachypnea, autonomic instability, muscle rigidity, and the change in LOC. Your interventions as a nurse is to notify the HCP, monitor vital signs, initiate safety and seizure precautions, prepare to discontinue the medication, monitor level of consciousness, administer antipyretics as prescribed, use a cooling blanket to lower the body temperature, monitor electrolyte levels and administer fluids intravenously as prescribed. Now let's look at the clinical manifestations of NMS. Hyperthermia, rigidity, mental status changes, and autonomic instability. The picture on your screen now is some things that you should look for during neuroleptic malignant syndrome. Mydriasis, diaphoresis, agitation, tachycardia, autonomic instability, often hypertensive, increased bowel sounds, may have diarrhea, clonus, tremor, and hyperflexia. Now let's discuss antipsychotic medications. Examples are haloperidol, loxapine, molendone, perfenazine. Your nursing interventions. Monitor for symptoms of neuroleptic malignant syndrome. Monitor for extrapyramidal side and adverse effects in client. To alleviate side effects, change position slowly for dizziness and report urinary retention, blood dyscrasias, and neuroleptic malignant syndrome. Anticholinergic, blurred vision, constipation, and drowsiness.
Remember, you are more than a conqueror and you will be successful. Join me as we review core content in the next unit.